This is Core Conversations with Natalie Baggio.
Welcome to this episode of Core Conversations. Today, I am joined by Scott Nolte. Hi, Scott. Thanks for being here today.
Hi, Natalie. I'm so excited to be here. Thank you.
Well, today we're going to hear what's happening here in Southwest Michigan around rehabilitation services. But first, I would like you to share a little bit about yourself in the community and why you chose the career path that you did.
Well, sure. I'm a physical therapist, and I became interested in physical therapy in high school when I had my own injuries. I had 3 surgeries before I graduated high school. And I originally received some therapy that didn't get me better. And then I found a therapist who really figured out my injury and got me on the road to recovery. And I knew that's what I wanted to do in life. And I ended up at Grand Valley State University, and I did an internship here in 1994. And I loved it as a student and decided to come back here once I graduated. And I've been here 31 years since.
So you've lived here for 31 years here in Southwest Michigan.
Yeah.
And how many years have you been leading rehabilitation services?
I have been the director here since 2007.
Wow.
So 23 years. Yeah.
That's exciting.
Yeah.
Well, thank you for your leadership and your commitment to Southwest Michigan. So a lot has changed in those years. And, you know, as a nurse, I got to know how the importance of specifically physical therapy, well, occupational therapy and speech therapy as well, working in critical care, where you'd see patients that could not get out of the bed or had challenges transitioning after a stroke to being able to speak, the importance of that care in the hospital. But you're also leading care outside the hospital. And not that long ago, I spent some time at your St. Joe site watching one of your therapists in a patient session rehabbing a patient that had charge syndrome. And it was really impressive to see the innovation and the techniques that you can use to motivate patients or clients to their desired outcome. And I'm excited for you to share more about what we're doing, how we're expanding care, and how we're keeping care local so patients don't have to drive to other aspects of the state or neighboring states. So what's new and exciting to share with the community?
Well, I think something really exciting is we just expanded a clinic in Berrien Springs. We doubled the size of it. We've had a clinic there for 25 or 30 years, and we doubled the size of it in around 2005. And in the last 20 years, we've doubled the size again. We were able to move the parking closer to the door and really just offer a first-class facility to our Central County residents there in Berrien Springs.
It's really interesting that you mentioned parking. That's very important to our community, that you have close parking and it's easy to access the care. So Berrien Springs is going well. I've heard a lot of great things that are happening there, and you have other new sites that are coming onto the market, right?
Yes, we do. On June 2nd, we'll be opening a new clinic in Bridgman, and we're super excited about that clinic. When we really looked at where our patients were coming from, we noticed how many patients were coming to us up in St. Joseph from the Red Arrow corridor, and thought we need to do something. We've had primary care down there for many years. So this is going to be a first-class, brand new clinic. So excited to bring therapy closer to home to the residents who live in our county down that direction.
That's great. Moving more in the Harbor Country area.
Yeah.
So why would patients reach out for rehabilitation services?
Well, the number one reason that patients seek physical therapy in the nation, and it's true here at Corewell Health South, is low back pain.
Okay.
And right behind that is shoulder or knee pain. When you think of a typical outpatient therapy service, that's about 80% of the patients that come. We certainly see neck pain, elbow pain, hip and ankle, and every other joint, a hand as well. But that is the most common reason that somebody seeks out our services.
That's great. And I noticed that when I visited the site in Niles, we partner with the Y and you have aquatic therapy in Niles and in St. Joe.
And Waterville.
And Waterville. Okay.
Yeah.
I've not actually been to that site to see the pool.
Yeah. Yeah. So aquatic therapy can be critical for patients who are just coming back from injury in a more acute phase. And we usually progress them from aquatic to land.
Okay.
And back to what they love to do.
But that's great. What I'm hearing is there's all different phases of care and therapies and treatments that allow patients to come into an environment that feels comfortable for them, but also a program where you have experts that know how to navigate them in the right phases to their comfort level and also to the progression.
Yeah, 100%. You know, when a patient comes in, we want to find out typically what is it that you can't do that you want to do. And then we set out a plan and a course of treatment to figure out how we're going to help that patient do that again and achieve that goal. And it typically involves movement. When we can't move, we can't do what we love to do. And when we can move, we can typically do what we love to do. And our goal is to get you doing, get you back to what you love doing.
Yeah. So are there any other new services, locations on the horizon or things that you'd want to share?
Well, sure. We're planning some new and exciting things in Niles.
Okay.
We are busting at the seams in Niles. We have 2 clinics currently, and we have had exponential growth down there. And so we're going to be looking at building a new orthopedic center of excellence in the Niles community, where the residents can have see their orthopedic surgeon and receive their physical therapy in the same building.
That's wonderful. And that's really good news.
It's so exciting.
Yeah. When you think about the growth and the new services, I always think about the workforce, because sometimes you can build buildings faster than you can recruit or retain people to help provide that care. Is there anything you're doing to grow your workforce and sustain your workforce?
Well, we want to take great care of our people. We want to make working for us the best decision that people can make in their careers. And so I think providing great work environments and the tools and resources that our therapists need to provide the best care for our community. We've got every new service that's out there, whether it's blood flow restriction therapy, dry needling, Schroth therapy for scoliosis. Pelvic health is the fastest growing area of physical therapy nationwide. And we're growing and providing these services as fast as we can throughout all the communities that we serve.
Yeah, that's wonderful. Well, it's been really great hearing about all the new innovations and locations and how you're keeping care local and reducing the drive time for our community. And I appreciate you joining us today.
Well, thank you so much for having me.
If patients are interested in if they would qualify for any of your rehabilitation services, how would you direct them to get in contact and learn more?
I would say give any of our clinics a call. Wherever you buy your groceries or go to the bank, there should be a clinic close to you. Feel free to call up that clinic, and we'll walk you through the steps to get an appointment and get started on your journey to recovery.
That's wonderful. And I love how you say anywhere you buy your groceries. So
yeah, wherever's close to home.
Yeah, I love that. And that's exactly what we want here in Southwest Michigan. So thank you, Scott.
Thank you, Natalie.
Thank you for joining us on this episode of Core Conversations. We'll see you next week.